You are working as a locum in a surgery and you are duty doctor. It is 10 a.m. on Monday and you are working your way through a long list of telephone calls. You have appointments free this afternoon to review patients if you need to. The next telephone call is for the following patient.
Hello, Doctor.
Hello, is that Rachel?
Oh yeah, hi. It's Rachel Bell here.
Hi.
Thank you so much. Thank you so much for calling me back.
Not a problem. How can I help today?
The thing is, Doctor, I've had this really bad headache for the last 24 hours, and I'm just at my wit's end. I don't know what to do.
Okay, can you tell me a little bit more about this headache?
Yeah, sure. Basically, my whole head is hurting, and it's sort of like throbbing quite a lot. And I have taken paracetamol, but it's it's just not done anything at all. So I was just wondering really if you could sort of help and if you had any suggestions, because I've not gone to work. So yeah.
Yeah, I'm sure there's a lot we can do to help. Can I ask you a few questions first?
Yeah, sure.
You say you've had it for 24 hours.
Yeah.
Did it come on suddenly or did it gradually build up?
No, it wasn't sudden. It was just sort of, I think it just started like a normal headache, and then it got worse. So yeah, that's kind of what happened yesterday.
So it got worse. And you say it's around the whole head's sort of throbbing.
My whole head hurts. It's not in one spot. It's the whole thing. It's awful, really awful.
Okay.
And I don't really know what to do.
Yeah, no, it sounds nasty. Can I ask you a few more questions, if that's okay, on about this headache?
Yeah, sure.
Is it affected by doing anything? You said it's not affected by the paracetamol, but what about eating, drinking, stooping, lying down? Does that make any difference?
No, it's just still really awful.
Just really awful.
It doesn't make make any difference.
And what about eyesight? Any problems with the eyesight, vision at all?
No, my vision's fine. It's really weird. It's just my head. I mean, I've had headaches before, but they've not been as bad as this. So that's why I'm quite worried, to be honest, Doctor.
Yeah, you sound worried. What are you worried it might be?
Well, I don't know. I mean, headaches normally just go away, and they don't sort of, they're just not this bad. Because I didn't sleep very well last night because it was so bad, and that doesn't really normally happen. So yeah, there's nothing really in particular. I just wondered what you thought it might be, and whether what you thought I should do, because I don't know. I try and avoid looking things up on the internet because I just get into sort of even more of a state, really.
Yeah.
But
have you done so?
No, I haven't.
You resisted that
my
urge?
husband. Yeah, my husband just he just sort of told me to take some paracetamol and to rest. So that's what I'm doing, really.
Yeah. Can I ask a couple of other general questions? How's the rest of your health at the moment?
I mean, it's not too bad. I have felt a bit washed out the last few weeks, but nothing in particular. I've not had any of these sort of awful coughs and colds that have been going around that other people in the office have had. So in that sense, I've sort of been okay. But I guess I've just felt a bit out of sorts.
Yeah. And you mentioned this is causing problems with work. You've not been to work today.
Yeah, I just couldn't. I just couldn't have coped. Couldn't have handled it. I felt really bad calling in sick, but I don't know how I would have functioned at work with my head this bad.
Yeah, I don't think you need to feel bad. We all get sick at times. What do you do for a living, Rachel?
I'm a PA in a law firm.
Oh, right. Okay.
Yeah.
Okay. Well, headaches can be scary, and they can be quite difficult to give you an exact answer of what's going on. But from what you've told me, it sounds pretty nasty, this headache, but it doesn't sound worrying. There's nothing that you're saying to me that would make me particularly alarmed.
Okay, all right.
Now,
Right.
headaches can have lots of different causes. The
Yeah.
most common reasons can be things like being dehydrated, not having had enough to drink, and being sort of dry. It can be down to
Right,
eye
yeah.
strain. It can be down
Right.
to, worry and stress. Do
Yeah.
any of those things sound
Yeah.
likely?
Well, I have been quite stressed. Yeah. I mean, I didn't think a stress would cause a headache this bad. But if you're saying it can, then it may be to do with that. Yeah.
You're under a lot of stress at the moment.
Well, it's just work's really busy. Like a lot of my sort of work colleagues and people I've been friends with for a while, they've lost their jobs, and they're not bringing in other people to sort of do the jobs that they're doing, and so the rest of us who are still there,
Yeah.
our workload is just so much. I mean, I've been really struggling, to be honest, and I can't. My job's quite important to me because my husband and I, we've got a mortgage together.
Yeah.
And it's just really difficult when people around you are losing their jobs, and I mean I don't feel I'm coping with the workload, and I don't feel I'm doing a very good job. So yeah, that's sort of been bothering me quite a lot.
Is there anyone at work you're talking to about this?
No, I mean, no, we don't discuss what's going on. It's because it's just awful, really. And I mean, I just wouldn't want anyone senior finding out that we've discussed things. So no, it's hard times out there, Doctor, in sort of in the working world.
Yeah, absolutely, it's
So
real world.
People are being made redundant at the moment.
Do you think there's anything that I could do, or the practice in general could do, to help you with your stress?
I don't know. I'm not sure really. I've not really sort of thought about how I can, how I'd be able to improve things, because it just all feels so overwhelming. So I don't know. But I mean, if you think that there's no sort of nasty cause for the headache, then that's very reassuring.
Yeah, no, I'm quite reassured from the headache's point of view, but I'm a little bit worried about the amount of stress that you're under. I'm just wondering if you know any of the doctors down the surgery particularly well, and whether it's worth me making an appointment for you to maybe pop in and see one of them later this week or next week and just have a chat about some of the stress you're under.
Maybe okay, that could be a good idea. Is it okay if I sort of speak to my husband and yeah, I mean, if he sort of also thinks it might be a good idea, then maybe I can give reception a call and arrange. There's a really nice lady doctor at the surgery. I can't remember her name, but yes, maybe I'll make an appointment with her.
Yeah, I think that's a good idea.
Okay.
Have a come in and have a chat to her about that, and say
All
be
right.
reassured about the headaches. It doesn't sound anything to worry about.
Yeah. Okay, so thank you. What do you sort of think I should do in the next, the next couple of days? Do you think it should slowly just get better? Is that what tends to happen?
Normally, these headaches, they do settle.
Okay.
So it's a case of thinking about what may be causing them. I mean, we mentioned, being dry and not having had enough to drink. We mentioned eye strain and, worry and stress. I would just be aware of those things and see what you can do to sort of try to minimise them.
Okay.
I mean,
All right.
keep taking regular paracetamol. It's not the best drug in the world, but it can help.
Okay. All right. Well, thank you so much. I really appreciate you calling me. I sort of feel a bit calmer about it.
Brilliant,
Thank
Rachel.
you.
Well, thank you for your honesty and thank you for chatting to me.
Okay. Thanks so much.
Take care now. Bye-bye.
Signposting helps keep the consultation clear for both patient and doctor. Asking permission to question further gives the patient back the locus of control. Giving positive feedback to patient suggestions further promotes the patient's locus of control. When a patient feels in control, this can help to alleviate stress. Keeping positive about the problem can be motivational. For example, "I'm sure there's a lot we can do to help." Covering red flags is essential for safe practice. Try to avoid asking multiple questions, as you can miss important information.